Where did it go? Hang on a minute. I think I've just like lost it. No, where is it gone? Ah, here, I found it. Alright, cool. Okay. Alright, I found it. Okay, so that's going. Alright, let's start the podcast. Okay, so hello and welcome Tina Christoudias-Spyrou. Tina is a Harvard-trained registered dietitian with nearly 18 years of experience as a nutrition counselor. Having had personal experience with hypothyroidism, she specializes in diet protocols for Hashimoto's thyroiditis and hypothyroidism, and has a book called Tired of Feeling Tired. She also writes for several international nutrition blogs. Tina is a strong advocate of the paleo diet and is an autoimmune protocol certified coach. So in this episode, we will be talking about whether the root cause of your PCOS is your thyroid. This is an important topic that really needs to be addressed because when diagnosed with PCOS, you're not really giving any kind of support or guidance on how to treat this condition. You're simply told you have PCOS, then you're most likely given the birth control pill or any other type of medication is sent on your way. There is no further examination of what may have caused this problem. Being given the pill as a source of treatment and then being told just take this and everything will be fine is not right, because these approaches don't get to the root cause of PCOS. In turn, you're not really treating the problem. This is why I'm really looking forward to this talk to help women find out what the root cause of their PCOS is. So let's get started. So Tina, can you tell us what PCOS is and what the link between thyroid and PCOS might be?
Well, sure. First of all, thank you, Despina, for having me on. I'm so honored to be here talking to you today. And I just wanted to say congratulations on the important work that you do, getting this information out there to a lot of people struggling with these issues. I think one of the most important things to kind of look at here is that conventional medicine kind of likes to make a diagnosis so that they can give you some sort of pharmaceutical intervention. And even though pharmaceutical intervention is necessary and even needed a lot of the time, you're right, we don't really look as a society of treating chronic disease. We don't really address the root cause of what's going on when we have an issue such as polycystic ovarian syndrome. And basically, looking at what functional medicine adds on to classical medicine is that we are looking for the root cause. And it's very important to understand that your body does not work in a vacuum. So what does that mean? Your thyroid doesn't work by itself. Your intestines don't work by themselves. Your brain doesn't work by itself. There's a constant communication going on between everything and all the organs in your body. And this happens with your hormones as well. Therefore, if you have a hormonal imbalance, of course your thyroid's going to be involved. There's like a thyroid trio, a hormonal trio. So you have cortisol, thyroid, and estrogen. Cortisol is a stress hormone. Under normal circumstances, we need a certain amount of cortisol to function. Cortisol is naturally high in the morning and it helps us to have that bright-eyed and bushy-tailed feeling in the morning. And it naturally depletes itself by the end of the day so that you can sleep. So melatonin, your sleep hormone, comes in and helps you sleep. The thyroid hormone, so we have thyroid hormones that are the storage form of thyroid hormones, T4 and T3. T4 is the storage form and is transferred to T3 within your body, which is the active form of thyroid hormone. So that again works closely with cortisol. So when we're really stressed out, our cells don't respond to thyroid hormone like the way they should be, therefore decreasing your thyroid activity. And then the other one is estrogen. Estrogen, when we have a lot of estrogen buildup within our bodies, those kind of take up the receptors for your thyroid hormone, and then your thyroid hormone doesn't function well. And what we see in PCOS is a state of inflammation in which all those hormones are kind of not really functioning optimally. And like this nice dance that's happening within all of your hormones is not kind of, people are tripping over each other, they're hurting each other, it's not really a dance anymore, it's chaos. So it's kind of intertwined. I would say that statistically, what we're seeing is that at least 25% of women that have a diagnosis of PCOS have an underlying thyroid issue. And unfortunately, even though a thyroid issue must be outruled before diagnosing PCOS, a lot of the time that doesn't happen. People are just given a diagnosis, as you said, of PCOS, and nobody knows that there's an underlying thyroid problem. So what can happen there is that we look at the entire picture of PCOS, and we look at what's going on in terms of inflammation within the body. And if you do not have enough thyroid hormone, you're not producing enough progesterone, for example, which for a lot of women with PCOS is very low. If you don't have enough thyroid hormone, you could be producing too many androgens, which again is associated with PCOS. If you don't have enough thyroid hormone, you could become insulin resistant, which is again another characteristic of PCOS. So as you can see, all these hormones kind of work together. And there was a recent review article from 2015 that I found that kind of looked at all of the research, looking at if thyroid disorders are associated with PCOS. And the authors concluded that although a lot more research needs to be done, there is a link. There's even a link saying that a certain amount of PCOS people, or women that have PCOS, actually have an increased risk of autoimmunity. We know that 95% of all hypothyroid cases, in other words, an underactive thyroid, has to do with having an autoimmune condition called Hashimoto's thyroiditis, which attacks the thyroid. So all these things need to be monitored and checked so that you can see that the cause of all this hormonal imbalance may well be a dysfunctioning thyroid.
Yeah, that's great information. And it's so important that you actually get to the root cause of any condition. But with PCOS, there's just a lot of different root causes as well. And it's important to get the checks done, and we'll address that in the next another question. Mm-hmm. But what might be causing the problem with the thyroid to be resulting in the PCOS symptoms and the hormone imbalance? What are the symptoms you might experience in, and what are the exact tests that you might have to get done to check your thyroid for our listeners to know, to go to their doctor and be like, hey, can you do these checks? Because obviously they don't just tell you, okay, let's dive in a bit deeper and examine it for you. You have to obviously sometimes go there and support yourself. So yeah, what would you say?
Yeah, that's a great question. I mean, when you have a lot of the symptoms for having a dysfunctional thyroid are actually similar to those of PCOS. So having chronic fatigue, having trouble losing weight, hair loss, insulin resistance, feeling like your hands and your feet can feel cold most of the time. I mean, that's an excellent test you can actually do at home by yourself, is that whilst you're lying in bed, as soon as you wake up, taking your basal temperature every day. And if it's lower than normal, that's indicative of an underfunctioning thyroid. So other symptoms that people may not associate with hypothyroidism, for example, are feeling depressed, having anxiety, having panic attacks. Thyroid hormone is needed in the brain to kind of settle your mood. So if you're experiencing a lot of these symptoms as well, and you don't know where these symptoms are coming from because everything in your life is fine, you're just feeling crazy for some reason, that could definitely be a trigger for you to go and test your thyroid. Seeing clients on a daily basis, what I see is that hypothyroidism is underdiagnosed. I mean, it's growing like wildfire throughout places that are westernized throughout the world. However, we see that it's highly underdiagnosed. A lot of the time what happens is that most conventional doctors will test for something called thyroid stimulating hormone, or for short TSH, and for T4, which is the thyroxine, the storage form of thyroid hormone. and they'll see a few numbers on the lab work, ignore your symptoms, what you're telling them, and say, well, you're fine. Well, there's growing research that shows that a lot of the time, a lot of the blood work could look normal, but you could still have hypothyroidism or Hashimoto's, which is the autoimmune disease that attacks the thyroid. So it's important to look at things like TSH, thyroid stimulating hormone, the pre-T4, pre-T3, also reverse T3. Reverse T3 is important to look at because it's kind of like a dud, but it could be attaching to the receptors that the active T3 attached to, and then you're getting a lot of thyroid resistance, thyroid hormone resistance. So it's important to check for reverse T3. Also, it's important to check for the antibodies. So you want to check for TPO and thyroid globulin antibodies. And those are your antibodies that, if raised, are attacking your healthy thyroid tissue. In addition to that, if you're kind of looking with your doctor and you're kind of skeptical that you have an issue, but you're still having all the symptoms, it's important to kind of look at, go and have an ultrasound done. So from an ultrasound, you can actually see on the thyroid patches where there are, where you actually see the thyroid that is being destroyed or on its way to being destroyed. So even then, even if the thyroid ultrasound comes out normal and the thyroid tests come back normal, but you're still having all these symptoms, it's still prudent for your doctor to kind of address that and say, well, there may be a thyroid problem here, because we're not a bunch of numbers on a paper. We're human beings with a lot of different things going on in our lives. So it's important to look at all these things when you're checking out your thyroid function. One more thing I wanted to say about TSH. The range of a healthy thyroid stimulating hormone is still highly debated upon endocrinologists. But more and more research that's surmounting on the topic is showing that, because usually in Cyprus, what you'll see is like a range from 0.5 to 4.5 for being normal. But most people usually report feeling their best from about 0.5 to a range of 2. So it's a much smaller range to have an optimized thyroid function and your TSH to be optimized. So again, if you get something back and your TSH is 3.5 or 4, and they're telling you that you're fine, you're not. You have your thyroid is sluggish, and you should check further into that and demand to speak to a doctor that has a little bit more of an open mind.
Yeah, that's true. Because a lot of the time, many patients are made to feel like they're crazy or something. But if you your body better than anyone, so it's not like doctors shouldn't be like saying, "Oh yeah, you're fine." The numbers say you're fine. If right. I feel like I'm not fine, I'm not fine.
Yeah, I got that a lot. It's all in your head. You're nuts. Go home and sleep. You'll feel better. Why don't you try exercising to lose your weight? And it's just like, yeah, I don't feel well. Like I can't get out of bed. How am I going to go running? So you need to find whoever it is, a doctor, healthcare practitioner, a nutritionist, nurse, whoever it is. They need to be understanding you, and they need to have an open mind to kind of work with you, to listen to you, because like you said, Despina, your body, your body better than anybody else. So if anybody is undermining that, they should be fired. You should pull you're fired. I'm moving on to the next person. Yeah.
So what do you think actually causes problems with the thyroid to become like underreactive or to become like a problem to come with it?
Mm-hmm. I mean, 95% of all thyroid issues are autoimmune in nature. That's a huge percentage. So 95% of the time, if you have antibodies against your thyroid, that means that it's getting destroyed because of the autoimmune attack that's going on. Other times, like in underdeveloped countries, for example, we have things like goiters. Goiter is when the thyroid expands in size because those underdeveloped countries are not getting enough iodine in their diet. But in westernized countries where the iodine is actually supplemented into things like salt and processed foods and things like that, we're actually seeing a massive explosion in an increase in autoimmune disease that causes the hypothyroidism. So iodine is important to take in, but it can be a very real trigger as well for the autoimmune disease.
Okay, that's interesting. Thanks for that.
Yeah.
So how do you go about healing your thyroid? Is there a specific diet you recommend or for healing these PCOS thyroid problems and healing your thyroid in general?
Sure. I mean, anything that is an inflammatory disease, anything that is a chronic disease that it attaches inflammation to it, we should be trying to eat as clean as possible and following an anti-inflammatory diet. Of course, this means many things for different people, but in general, from my experience and from the research that I've done, we want to kind of decrease a lot of the grains. For a lot of people, that means completely avoiding gluten, which is the protein found in wheat. Gluten has been highly correlated with autoimmune disease in general. So just avoiding gluten, especially if you found out after being diagnosed for PCOS that you have an autoimmune thyroid condition, you want to make sure that you're getting rid of that first. The other thing to kind of get rid of is conventional dairy. Conventional dairy, because a lot of it is not from cows that are grass-fed and pasture-raised, and they're being given these genetically modified feeds, which increases their inflammation, which then increases our inflammation. We should kind of be avoiding that. And in general, in the beginning, when you're doing, I usually recommend the 1 to 3 month elimination diet for a lot of my patients. In general, we should be avoiding dairy because not only are a lot of people lactose intolerant, which is the sugar found in which is the sugar found in dairy products, but these dairy products also contain casein, which is the protein found in dairy products, which can act similarly in the body like gluten. So we want to make sure that we're just avoiding these things in general in the beginning of our elimination process. And of course, another huge one is sugar. We are so dependent on sugar, it's kind of disgusting. 200 years ago, the average person had about 20 teaspoons of sugar a year, whereas our kids today are having 35 teaspoons of sugar a day. So I'm convinced that sugar is just as toxic for you as any drug, any illegal drug, I should say. So we should really be trying to avoid a processed-based diet and getting rid of all the sugars, getting rid of all the additives. It's important to say here that a lot of the additives and a lot of the way we're growing our foods, there are more hormones in our foods, and we're seeing these fake estrogens get into our foods, and if we're eating them, we see a lot of hormonal imbalance, not only in women but also in men. A lot of men are getting female-like symptoms because of all these high estrogens in the food supply. So kind of choosing to opt for as organic as possible, choosing grass-fed, pasture-raised meats, free-range chickens, wild-caught fish, as natural as possible is the key to healing. Now, there's different variations of how to eat for this. And one thing that I've learned by doing this job for almost 20 years is that everybody is different. And that's why I think it's so important that you work with a trained professional on your diet, because what works for you is not going to work for everybody else, and vice versa. And that's why it's so important to really scrutinize over yourself and what you are able to tolerate on your journey, rather than what you're reading in a million articles, or what your friend is doing, or what your aunt is doing, or whatever. It's very important to find what works for you. So that's another kind of thing that you can choose. For example, if you have PCOS and you found out that you have an autoimmune disease that attacks the thyroid, you can also opt to follow an autoimmune protocol. And what the autoimmune protocol basically is another version of an elimination diet. The elimination diet is basically you take out grains, dairy, legumes, beans, which stings for a lot of Greeks, but okay. You take out nuts and seeds. You take out some adaptogenic herbs like ashwagandha. You take out a lot of what's the other? I'm forgetting one more thing. But in general, you take out all these foods as an elimination version, and you start to reintroduce all these foods one at a time to see what bothers you. And it's important to note that if you reintroduce a certain food, let's say you start putting almonds back into your diet, if you get a reaction from that, it doesn't mean that you will not be able to tolerate almonds in the future, because you just want to give time for your intestines to regrow and heal ultimately. And we see a lot of reversal. I've seen a lot of reversal in my own patients that are on the autoimmune protocol with their own PCOS symptoms, like their insulin resistance is reversed, they have a lot more, their hormone balance is better, a lot of the lab work that they do is better. So it just shows that what a huge impact what you're putting in your mouth is making on your body. Yeah. So yeah, there's lots of different routes you can go through. There's lots of things you can do. But in general, if there was one piece of advice that I would give people that are trying to take their health back into their own hands, is to eat a diet from real food. And there's a huge disconnect now, like we're all used to buying stuff from boxes. And a good rule of thumb is if your grandparents or great-grandparents did not eat this stuff, you should not either.
Yeah, so. I agree. Definitely. Like food really is medicine. It's so powerful. Nutrition, a lot of people don't think nutrition can actually heal. I remember I'd done this one little live stream, and I mentioned how nutrition really is important. And people like, does it? Are you telling the truth? Like, is it really? And I'm just like, yeah, food really is medicine. Like, but you hear it a lot, but people still don't really believe it. And it's just, we have to change our mindset towards how important what we eat actually, actually makes a difference in your body.
Of course, it just kind of shows as well how brainwashed we are to thinking that, you know, our medicine lies in a pill, which again can help, and of course can help. But what about the rest of the stuff? So basically, if I'm sleeping bad, not exercising, eating all processed foods, these things don't matter? Of course they matter. Exactly. They're the foundation of what you're trying to do for your health.
Yeah. So would you, when you're talking about pills and medication, would you say there's any supplements that could help your thyroid and PCOS?
Sure, there's lots. And a lot of people ask me too, well, shouldn't we be getting all our food, all our supplements, all our vitamins and minerals from food? And I say to them, well, if you consider that if you have one day of stress, that your nutrient requirements increase by about 300% for one day, and most thyroid patients have a lot of digestive issues too. I don't think you're going to initially get all the supplements all the vitamins and minerals that you're going to need from your diet. Eventually, that's what I would like to happen. I want the diet to take over and to supply all that nutrient density, because nature is a wonderful thing. God created the planet in a way that, you know, it just makes sense. So you have your food, and the food has the vitamins and minerals are mixed together in such a way that your body just recognizes it and understands it and knows how to absorb it and do what it's going to do with those nutrients. But in the beginning, what we want is to kind of help the person feel better a little bit faster so that they're encouraged to keep going. So there's many different supplements that can help your underactive thyroid. And the first one that's highly important is selenium. Selenium is a mineral that actually helps decrease your antibodies. There's research that shows that after taking about 200 to 400 micrograms of selenium after 6 weeks to 2 months, that it could reduce your antibodies in half. So selenium is a huge one. It's also very important to help the body transfer T4, the storage form of thyroid hormone, into T3, the active form of thyroid hormone. Another very important one is zinc. Zinc also helps the T4 to T3 conversion. It's also very important mineral for hair. A lot of women that have hair loss, when they add zinc back into their diet, they can actually see kind of like their hair stops falling out. And also very important to note is that if we're taking a lot of zinc, it's also important to add copper, because if you take too much zinc, the copper could go out of whack. And if you take too much copper, the zinc could go out of whack. So these two kind of work together. And a good rule of thumb is that for every 15 milligrams of zinc that we're taking, we should be taking about 1.5 milligrams of copper. Okay, so it helps to do that balance. In fact, copper is kind of so important that a lot of the time they use something called the selenium to copper ratio to understand if you're having thyroid hormone resistance. In other words, your cells aren't responding to the thyroid hormone. So yeah, taking a little bit of zinc and a little bit of copper is very important. Another adaptogenic herb that can probably help a lot of people with PCOS to regulate their symptoms. What does adaptogenic mean? It basically means if, for example, your estrogen is too high and your progesterone is too low, that adaptogenic herb comes in and it balances them so that they're where they should be. And one of these ones that I use quite often with my clients and we see great results is called maca, which is a tube root. And it does wonders. I mean, I typically start people off on 2 grams on their first day of their period. And we see a lot of people reporting back and they're like, I didn't have all the symptoms associated with my period that I usually have. The cycle got cut in half. Instead of, waiting 2 months to get my period, I got it in a month. So that's kind of a great one to kind of regulate all those hormones working together. Other ones, another great one for menstrual cycle and for the thyroid and for everybody really, because we're all deficient because of our food system lately, is magnesium. Magnesium is one of these minerals that is just like the wonder drug for everything. It also helps with a lot of issues like constipation, which is common with hypothyroidism because, again, things work together. Your intestines need enough thyroid hormone to move fast enough. So magnesium can help with that, especially one called magnesium citrate. And taking about anywhere from 400 to 1,000 milligrams of magnesium every night before you go to sleep helps the intestine to work better and helps you to sleep better. So I think these are kind of the main ones in terms of supplements. One more to perhaps consider is that because with Hashimoto's patients, we see a lot of, they do not have enough stomach acid and therefore do not break their food down properly before it gets digested properly. We see a lot of B12 deficiency, and vitamin B12 is vital for nerve health. So a lot of the times those symptoms will appear as tingling in your extremities, in your head, in your hands, in your feet. And a lot of the time, because we cannot absorb B12 properly, it's important to get a supplement that is sublingual under the tongue, and you allow it to melt in your mouth to get absorbed that way. These are basically the basics for your thyroid. There's definitely a lot more, and it's a lot more in depth because, again, we look at the patient as a whole. We're going to ask about the intestinal health. We're going to ask about their hormonal health. We're going to ask about their sleeping habits, their exercise habits, stress management habits. All these things count when you're looking at how to heal the thyroid and how to regain hormonal balance.
Yeah, that's great. So that last bit you touched on about sleep and exercise, stress management. What kind of lifestyle changes does someone who's looking to heal need to start implementing?
Well, I think it's true of the times that we're so caught up in the rat race, let's say, that we're not really taking the time to do what us human beings were programmed to do. One very important part is sleep. I mean, we have been programmed since the beginning of the earth, like every cell on this earth, every organism is in tune with the light and dark cycles of the earth. So that means that our hormones are programmed to respond to the light and respond to the dark. But because of technology, and because of busy schedules and whatnot, we are just completely disconnected from this cycle. And so, for example, I had mentioned before that when you wake up in the morning, you have higher cortisol levels. So when your body senses light from outside, it starts stimulation of cortisol to wake you up. When your body senses that the light has gone away, it signals the body to produce melatonin, which is your sleep hormone, to start sleeping better. So a lot of my clients, one of the biggest questions I ask is, how's your sleep? And I would say about 80% say not good. Either they don't sleep enough or they don't sleep well. They keep waking up throughout the night. So doing things to go back to nature will help your sleep pattern a lot. So for example, working on your laptop or looking at your phone right before you go to sleep is not a good idea, because your body translates that light as, okay, time to produce cortisol, wake up. So your sleep pattern is disrupted. So avoiding that for perhaps an hour before you go to bed, and going into doing things that kind of relax you and put you in the mood for bedtime, taking a nice bath, perhaps with magnesium salts, that helps you to relax, dimming the lights in your room, just putting a little bit of light, so maybe perhaps you can read something, and just giving signals to your body that it's time to sleep. And although these things may sound like common sense, unfortunately, common sense is not so common anymore. So we have to kind of remind ourselves of those things, that, it's time to go back to nature and back to how we were meant to be living. So once you start improving your sleep patterns, you'll see that you'll be sleeping better throughout the night. And of course, diet has a lot to do with this too. If you're eating a lot of sugar, if you're eating a lot of processed foods, your sleep pattern is again interrupted, because it's just producing that stress hormone of cortisol. So again, an anti-inflammatory diet is going to help your sleep pattern as well. And in turn, when you're not sleeping well enough, you signal hormones that want sugar. So you crave bad stuff and you eat more sugar, you eat more processed food. So everything is intertwined and everything creates a vicious cycle, or everything can create a good cycle as well. So for example, you eat well, you do your relaxation method before you go to bed, you turn off the lights, you sleep better. Because you're well rested, you eat better foods, and it just creates a much better environment for what's going on inside of your body. Other lifestyle changes. I see from my experience that above diet, I think the biggest lifestyle change to make is stress management, is reducing your stress. And a lot of people say, yeah, okay, Tina, better, easier said than done. And of course, it's easier said than done. However, when it comes to our health, I believe that if we put it as a priority and to do things that make us happy in our lives and to reduce stress, we're going to see such a huge improvement in how we're feeling. Since PCOS is targeted towards women, I think it's important to say this to women. We have to learn to say no. A lot of us, we just say yes to everything. And women are such capable beings. Like, we multitask, we are in charge of so many different things throughout, like so many things going on throughout the day that we just explode with how many things that are going on. But we need to learn to say no, and we need to start saying yes to ourselves. And in the beginning, it's very challenging, because I was a huge yes person. And in the beginning, I was like, no. But after a while, you kind of start gaining confidence and you say, well, no, I'm not comfortable with doing that. So, maybe perhaps we can try this instead. So learning to say no. In the beginning, it may be baby steps, like learning to say no to your child that wants to eat 20 chocolates, just giving an extreme example. But it can be baby steps of learning to say no. The other thing we can do for stress management is just taking the time to breathe. I mean, a lot of people say, meditate, pray, do things that are calming to the body, which are just as important. But I think another baby step towards that is learning to breathe. We have disconnected with feeling oxygen enter our bodies. So what you can actually do is breathe in for 3 seconds and breathe out for 5 seconds, and do this whenever is needed throughout the day. And you'll see that your brain kind of reboots and you start to calm down. The next level to that is kind of looking at meditation programs, or if you believe in God, praying. I mean, there's even research that people that pray have less disease because it's a form of meditation. So there's apps now that you can download that will help you with guided meditation. In the beginning, you're going to feel really weird. You're going to be like, I can't do this. My brain is constantly moving. But after a while, basically practicing meditation is like doing bicep curls for your arms, In the beginning, it's going to feel weird. You're going to be really sore. You're not going to want to do it anymore. But every time you kind of stop thinking for a moment, that's like doing a bicep curl for your brain, because you shut off your brain and you shut off, you put your body into a state of relaxation. Now, all of us as animals, we should be having a certain amount of stress in our lives. We're programmed to go, 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 but we're also programmed to rest. But most of us are going, 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 and we keep on going. There's no time for rest. So it's just as important to rest as it is to keep going. Another important lifestyle factor is definitely movement, exercise. And again, just like nutrition is specialized for the individual, so should the exercise program. I'm not an expert in exercise, but there is some research with autoimmune disease showing that if you overdo it with exercise, and that overdoing it, the definition is defined differently for everybody. But if you overdo it with exercise, you can actually trigger an autoimmune attack. And also being completely sedentary also can trigger an autoimmune attack. So it's very important to find exercises that just resonate well with you. For me, I used to love running, but it was just not doing a good thing for me at all. So I've kind of transitioned into more walking outside in nature, sometimes Pilates, sometimes yoga, things that kind of relax me, but at the same time do some strength training for my body. And again, it's working with a professional that knows about these things that's going to help to guide you in your journey towards how you can implement activity into your life. Everybody's different. So yeah, we've said sleep, we've said stress management, and we've said exercise. I think that's important. I think another one that like we're in charge of, and this is why people like Despina are doing these interviews, and I do what I do, is to get the message out there in terms of that you can be a huge advocate for your health. And by learning more, you can be more educated in the kind of tests and questions that you're asking of your doctors. And you can say it to them in a nice way. I mean, a lot of the time what I would do is kind of bring books written by professional doctors that are talking about a more functional medicine scope. And I would kind of show them studies and say, can we try this? Like there's some research on this, or can we do this a little bit differently? And you are the people that are going to be, all of us are the ones that are going to make a loud enough noise to have, doctors change the way they do things, have a more open mind towards medicine, have a more open mind towards how people are being helped. And I keep saying doctors, but it's not just doctors. It's registered dietitians, it's nurses, it's physiotherapists, it's, everybody that's involved in helping people with their health. To have a more well-rounded approach to people and to treat people as a human being, that, to ask about their psychology, to ask about their, what's going on in their lives, to ask about, how they're functioning on a daily basis. Not just, okay, let's focus on the nutrition, not just, okay, let's go and exercise, not just, okay, here's a pill and goodbye. So yeah, we really need to make a movement, and it's up to all of you. We really need to make a movement to say that, listen, we have rights, we want our health back, and we want to work together with you. We don't want to go against you, we want to work together to feel better. And I think that's a huge lifestyle factor, having a voice and not being afraid to use it.
Yeah, you said some really good points, and I agree with everything you said. And yeah, thanks for that. And to kind of wrap it up, you've written a book, and it's out. called Tired of Feeling Tired. What can people learn from this book, and what can they find in it?
Yeah, Tired of Feeling Tired. I came up with the title because that's what I was, tired of feeling tired. And it's a book basically that addresses how nutrition can be a major life force in healing symptoms associated with hypothyroidism. And basically people within that book can find out how to heal their gut, how to follow a gluten and dairy-free lifestyle, how to follow the autoimmune protocol if they need to, how to eat for adrenal health, because again, the adrenal, another form of hormones, that cortisol that we talked about, how to eat for adrenal health to help your thyroid be more balanced. It basically gives a summary. It also talks a little bit about hormonal health and how that affects the thyroid, and what foods and supplements you can implement into your daily routine to help your hormones to be more balanced. So yeah, it's just I took a while to write it because I wanted it to be as understandable as possible. So it can be like your initial guide into how to start eating an anti-inflammatory diet to bring you towards better health. Because for me, especially when I cut out things like gluten and dairy, it was like my eyes woke up and I joined the earth again. It was like a huge part of my healing journey. So it's just a guide to help you get on the right track and take your health into your own hands by making those first steps with your diet.
So where could people buy this book?
Yeah, it's available on Amazon, on the book depository, any internet site that sells books, it's there.
Oh, that's great. That's awesome. And finally, where can our listeners connect with you?
Yeah, I have a Facebook page and an Instagram page. You can find me there as the Thyroid Dietitian, and you can also find me on my website, www.thethyroiddietitian.com. You can send me an email through there. On my website as well, I have a free thyroid nutrition guide. So it kind of is like an ebook that gets you started in more detail on how to follow a gluten and dairy-free program. And it gives you a 7-day menu plan of an autoimmune protocol program as well.
That's awesome. I think we've covered so much information, so much valuable information that I think a lot of people will find a lot of benefit from. And just to help them, obviously with their diet, lifestyle, and to get to the root cause of their PCOS, to go with the knowledge now to their doctor and get those tests done, and then start making those steps to try and heal their thyroid PCOS, take back control of their health. So thanks so much for coming on the podcast and spilling your knowledge and raising awareness.
My pleasure, Despina, my pleasure, and thanks for having me. I'm always so honored when anybody asks me to talk, because it's all about spreading the message, getting people back to healthy. So thank you for that.
Thanks again.